My name is John W. Thomas Byrd, and this practice is the Nashville Hip Institute here in Nashville, Tennessee. I'm born and raised right here. I graduated from Vanderbilt University School of Medicine, as did my father and his father before him. Nashville is known as the Athens of the South because it used to be the educational and cultural center of this part of the country. I did my first arthroscopic hip procedure in 1990. One of my partners at the time had a teenage kid with loose bone fragments in his hip, and they were going to take these out with a big open operation, and they asked me, what do you think about trying to retrieve these with the arthroscope? I'd never heard of such a thing, but I thought we could make an effort, and basically I used the arthroscopic techniques for the knee and the shoulder that were taught to me by my mentor, Dr. James Andrews, and we developed a technique for the hip, and it worked. That was 1990. In 1994, we published our technique for performing hip arthroscopy, which is the method that is most popularly used around the world. Working with the Titans is my weekend job. I've been very fortunate working. I started with the Tennessee Oilers in 1997. The first 2 years they were the Oilers, and then switched to the Titans. That's sort of maintaining a little bit of my background in sports medicine, as so much of my world has gotten consumed by the hip arthroscopy and the hip preservation side. My father taught me much growing up, and Dr. Andrews taught me the art and science of sports medicine, especially how to treat special people like they're regular folks and how to treat regular folks like they're special. We doubled our center from 1 to 2 surgeons when Dr. Tanya Ferguson and I sort of merged our practices. She brought her West Coast experience, and she brings an incredible skill set within the hip that I do not possess, and collectively we complement each other, being able to cover pretty much the entire spectrum of hip disorders, remembering that not everything we do revolves around surgery, but also a comprehensive strategy on how to help improve the quality of people's lives and improve their function. Sometimes that involves surgery, but oftentimes it involves a myriad of other resources and opportunities to get them better. And certainly the program and the facility we have here, where we have everything pretty much under one roof. We have our team with the nurses and the PAs. We've got the rehab facility right here with the physical therapists and athletic trainers, because it's not just about the surgeon. I'm a single part of the comprehensive program that we have here. People come to see us from all around the country and literally all around the world, and I would put our team of nurses, nurse practitioners, PAs, physical therapists, and athletic trainers, a very seasoned bunch, up against any group in the world. The most important part of the practice here are the people. Everyone here is supremely committed to one thing, and that's the patients that we're given the blessing to serve.